Hello everyone, I am Dr. Vivek Venkatramani, consultant Uro-Oncologist and Robotic Surgeon in Mumbai. Today I thought we could discuss a bit on the future of robotic surgery and how things are changing, as well as what role potentially artificial intelligence and AI could take in both the diagnosis as well as planning treatment, medical as well as surgical. As we all know, robotic surgery is one of the most advanced forms of surgeries that we have today as uro-oncologists especially. It has really revolutionized cancer treatment over the past 2 decades, and today a vast majority of our uro-oncologic surgeries can be done by this approach. The robotic surgeon basically sits at a console, and robot meaning slave. The movements that I do at the console are translated into the patient's body with the help of specialized narrow thin instruments. This has advantages both for the surgeon as well as the patient. For us surgeons, it is a very comfortable ergonomic position. There is a 10 times magnified view and a 3-dimensional immersive view, which means we are almost like sitting on the organ of interest and being able to visualize things very carefully and very precisely when we do the surgery. It allows us to access narrow areas like the male pelvis, which is otherwise very difficult to reach in a traditional surgery, and do very delicate maneuvers like suturing the bladder down to the urethra, things which were very difficult to visualize in open or laparoscopic surgeries. For the patient, it has all the advantages of a minimally invasive surgery, which include less pain, less blood loss, more rapid recovery, less scarring and post-operative infections, as well as an earlier return to work. This also translates to improved functional outcomes, especially in prostate cancer surgery, where both erectile dysfunction and urinary incontinence or leakage are reduced due to the advent of robotic surgery. Even today, robotic surgery is being advanced at a really fast pace due to research and competition among multiple companies. There are now different robots available, and each company is trying their best to develop the best possible robotic system. This leads to better patient outcomes as well as better features on the robot, which allow us to do more safe and precise surgeries. One of the newer advantages is a tactile or feel approach in the robotic system. This was one of the major limitations of prior systems, in that you couldn't feel what tissue you were cutting. But with newer sensors and better technology, this is something that we expect to be overcome in the coming years. There is also a lot of research going into the use of augmented reality in these newer robotic systems. This will allow us to actually superimpose the patient's CT scan or MRI on the surgical field while we are performing the robotic surgery, and try and then remove more precisely the tumor itself and leave the normal area intact. This is under a lot of study now, and newer softwares are being developed which will allow us to do this in the coming years. The use of 3D printing allows us to print out precisely the models of complex tumors before the surgery and study the tumor in relation to various special other structures like arteries, veins and nerves and other surrounding organs, and this also increases the precision of the surgery. Advances in simulation technology allow surgeons and trainees to practice the surgery a number of times before actually going and performing it in the patient. There are simulators available with almost all robotic systems which give a very realistic representation of what we would be encountering during the surgery itself. The use of animal models also helps to improve our skills before operating on a real patient. However, of course, there are ethical concerns and availability concerns with animal models. As there are a lot of developments and research going on in robotic surgery and surgery in general, I have made a continuation on this in my next video. So please don't forget to subscribe to be notified of that video when it releases.